Hello and welcome back to my channel. My name is Oluwafunto, and in this video I'm going to be talking about the various gastrointestinal disturbances and what distinguishes them. Returning subscriber, welcome back to my channel. I hope you do like this video, and if you're coming across this channel for the first time, I hope you like this video, and I really hope that you do subscribe at the end of the video, or you may as well subscribe right now. Gastrointestinal disorders. There are various gastrointestinal disorders sharing similar symptoms and similar treatments. Hence the reason why I'm making this video, so you can be able to differentiate or distinguish between one and another. Gastrointestinal disorders are disorders of the digestive tract. The digestive tract comprises of the mouth, the esophagus, also known as the feeding pipe, the stomach, the large and the small intestine, the rectum, and the anus. So any of these parts that I've mentioned can be affected in GI disorders. GI disorders vary from peptic ulcer disease, gastritis, dyspepsia, heartburn, acid reflux, irritable bowel syndrome, ulcerative colitis, and many more like that. But before I get to this, I'm going to be mentioning some very common symptoms that we have in the GI that can indicate any of these symptoms or any of these conditions. We have abdominal discomfort, which is bloating, pain, or cramps. We have heartburn or acid reflux. We have constipation, we have diarrhea, we have nausea and vomiting, loss of appetite, difficulty swallowing, unintentional weight loss, and sometimes there could be blood in stool or vomits, which requires immediate medical attention. So these are various symptoms that you see in different GI conditions. Now, how do you know which is which? To be able to clearly differentiate symptoms, a diagnosis must be gotten from a medical officer, and treatment can then be commenced. In this video, I'm going to be talking about 4 of these GI disorders. This is because the treatments are quite similar and even the symptoms are quite similar. I'm going to be talking about peptic ulcer disease, gastroesophageal reflux disease, that is GERD. I'm going to be talking about dyspepsia and gastritis. Gastritis is simply stomach inflammation. It is a condition where the lining of the stomach is inflamed, just like I'm showing on the screen right now. Inflammation of the stomach. It can be caused by infection, injury, regular NSAIDs use, or too much alcohol. And when I say injury, that could be an ulcer. Gastritis may not present with symptoms, but it may also present with symptoms like upper abdominal stomach pain. Of course, the stomach is inflamed, so that will cause some level of pain. And the person could also have nausea and vomiting. The treatment is usually an antacid to neutralize the acid content of the stomach, or depending on the cause of the dyspepsia, antibiotics can be used. Like I said, it could be caused by injury. So in a case where it is H. pylori that is causing the injury, that is an ulcer, antibiotics will be used. Now, dyspepsia. Dyspepsia is simply indigestion. This is when the body or the stomach has trouble digesting food. It is characterized by upper abdominal discomfort. Of course, the stomach is full and unable to digest food properly. So there will be some level of discomfort in the stomach, a feeling of gasiness or bloating. While eating, you feel full too quickly, or after eating, you're going to feel like you ate more than you actually ate. Dyspepsia may not be as a result of an underlying condition like an ulcer or something else. It could be as a result of overeating or overdrinking, or eating something that your body does not tolerate, that is food intolerance, or something that generally irritates the stomach. Dyspepsia can be easily treated by the use of antacids and other lifestyle modifications that I'm going to be talking about later in this video. Now, GERD. GERD, that is gastroesophageal reflux disease. Just as the name implies, there is a reflux of acid from the stomach back into the esophagus. It is a digestive disease in which the stomach acid irritates the lining of the esophagus or the food pipe or the feeding pipe. The major symptoms of GERD are acid reflux and heartburn. So like I said, there will be a reflux from the content of the stomach, that is the stomach acid, into the esophagus. The esophagus has something we call the lower esophageal sphincter, just like I'm displaying right now. The lower esophageal sphincter is supposed to close so as to prevent the movement of stomach acid from the stomach into the esophagus. But in a case where there is problem with the lower esophageal sphincter, or for any other reason the LES is open, the acid, the stomach content will move from the stomach into the esophagus, thereby irritating the esophagus and causing a burning sensation that most people refer to as heartburn. That implies that heartburn is not a disease on its own, it is only a symptom. Symptoms are usually pronounced after eating or while lying down. So patients can be advised to always stay about 3 hours or more after meal before lying down, or they can also be advised to raise the head of the bed so they can be in a more comfortable position. People with GERD may also experience regurgitation. GERD is usually treated with antacids and PPIs, that's proton pump inhibitors. The antacid is to neutralize the acid. Like I said, the stomach acid is involved, so the antacid is to neutralize the acid, while the PPI is to reduce the acid that is being produced by the stomach. That's acid suppressing agent. Now to peptic ulcer disease. I already have a whole video on peptic ulcer disease, so I'm just going to be talking a little about it. Peptic ulcer disease is simply an injury in the stomach lining caused by stomach acid. It occurs when acid damages the lining of the digestive tract, either in the stomach, in the upper part of the duodenum, or somewhere in the esophagus. If there is a sore, that is an ulcer. The symptoms include pain in the upper abdomen. It could be a burning pain or a gnawing pain or a dull pain. Other symptoms associated with other conditions I've mentioned can also be found in peptic ulcer disease, like heartburn, indigestion, constipation can all be found in peptic ulcer disease. I hope I've been able to give you a picture of what each of these conditions look like. Now, what do these GI symptoms have in common? What these GI symptoms majorly have in common is the fact that they all occur in the GI and they are all caused by stomach acid, and they are all managed similarly. Now, I'm going to be talking about their management, but I'm not really going to talk much about that. I just want to highlight some things like the lifestyle modification. Now, there are some lifestyle modifications that must be made for people who suffer from GI disorders. The first thing is to avoid trigger foods like fried foods, spicy foods, chocolate, onion, garlic. Foods that will stay longer in the stomach are to be avoided. Fried food will be digested slowly in the body. Spicy food will irritate the esophageal or stomach lining, so those should be avoided. Drinking of water instead of soda, limiting of caffeine and alcohol intake, whatever will irritate the lining of the stomach or esophagus should be totally avoided. Smaller meals should be eaten more often rather than eating a large meal at once. It is better to eat small meals in bits, and also eat slowly. Maintain a healthy weight. Losing weight can really help with GI disorders. And avoiding tight-fitted clothing. Waiting 3 hours or more before going to bed and raising the head of the bed, like I said earlier. Waiting 3 hours before going to bed will help the food to have digested before going to bed, and raising the head of the bed will help the lower esophageal sphincter to be facing below, to face down and not go back up into the esophagus. For smokers, you need to avoid or totally stop smoking because this will definitely irritate the esophageal lining. Now, the medications used for these conditions, though not for all, but one thing they have in common is antacids. For every of these conditions, an antacid will be suitable to neutralize the acid content in the stomach or in the esophagus. H2 receptor antagonists, which is comprising of cimetidine, ranitidine, famotidine, and the likes. We also have proton pump inhibitors, PPIs, comprising of omeprazole, rabeprazole, esomeprazole, and the likes. We have prokinetics like metoclopramide, which helps the movement of food through the stomach. Finally, we have antibiotics in cases of H. pylori involvement, like in peptic ulcer disease that is caused by H. pylori. We need to use a combination of some antibiotics like amoxicillin, clarithromycin, or metronidazole. Antibiotics may also be needed in a case of gastritis that is secondary to peptic ulcer. Like I said earlier, the presence of blood in the vomit or the stool in any of these gastrointestinal disorders calls for immediate medical attention. If you liked this video or you learned something from it, please give me a thumbs up with your thoughts and your questions in the comment section below. And if you are yet to subscribe, please do subscribe to my channel and click on the notification bell so you can be notified whenever I post a new video. Thank you for watching. Bye.